Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for joining us today. This is AARP Arizona Hispanic Connection. We have a very important show today. We are addressing a very important topic, and that is Medicare, Medicaid, and ACA. I'm sure many people do not understand what ACA means, but we'll help them understand. If I say Obamacare, I'm sure people will automatically understand that what ACA. ACA stands for the Affordable Care Act. The Affordable Care Act. So we're going to try to do, I don't know if I should call it magic or maybe a miracle, because we are addressing three huge programs that even just to address them one by one would take a long time. But I think we're going to take an approach that might make sense, and hopefully it does. Let me start from my left. We have from my left Lenny Estrada. Lenny Estrada works for the Area Agencies on Aging, but it's a very special program called Senior Medicare Patrol. Lenny, thank you so much. First of all, you've been with us before, and I thank you for making time to be with us and help us understand in a little bit that there is such a thing as fraud in Medicare, and we would like to learn how that happens. And you're basically asking seniors to become, to be patrollers, right? Welcome to our show, Lenny.
Thank you.
Yes. We also have Alfredo Alvarez, and Alfredo Alvarez works for the Area Agencies on Aging. Benefits Assistance Program is also called the SHIP program, which stands for State Health Insurance Program. And then he is a counselor for Medicare. Again, Alfredo, you've been with us before. Thank you very much.
Thank you for the invitation, David.
Yes. Then we have Libby Pearson. Libby Pearson is the program supervisor for KIAC Health Connections, and they do great work. They help people to, we asked you to be here for us to basically address access, but can you tell us just a little bit what else, welcome, and if you can tell us a little bit what else you do or KIAC does?
Well, KIO provides free application assistance for all the public benefits such as access, food stamps, cash assistance, kids care, and also the marketplace. That's
amazing. That is amazing. Can you repeat it again? Because we would like people to really, really get to know your organization. I think it's an amazing one. And we really want them to basically know how to get a hold of you in just a little bit. But just again, what programs or what services do you provide once again?
Free application assistance for access, food stamps, cash assistance, kids care, and then the marketplace as well.
Do you have so all of your staff is versed on all the issues pretty much on how to help people apply for all those benefits, or you have specialties?
No, all of my navigators are actually trained to do both access applications, and some of them are going, again, through the training for the marketplace.
Great. Wow, that's an amazing program. And we have also Alan Jersvig. I had to practice that to pronounce your name, Alan. And you are the Director of Navigator and Enrollment Services for the Arizona Alliance for Community Health Centers. And you also work and are a member of the Cover Arizona Coalition. Am I correct on that?
Yes, you are. And thank you for having me back, David. And I'm happy to be here today because I've had a chance to meet the gentlemen that are here before. But I have to say that Livy over at Keogh Health Connection, they are one of our Navigator partners. So we work with all the community health centers in the state. They all have people that can help people enroll in these same benefits. And then we have a small group that we help with some federal funding to become a navigator, and Livy is a star.
Perfect. I agree. Let's get started then. Again, we are addressing the basics of Medicare, Medicaid, and ACA. Maybe we're the only crazy ones who dare to even dare to address these huge programs. But I think when we finish our program, we would have presented a good picture of these programs, and I trust that you agree with us. Let's kind of get started. The healthcare in America is pretty complicated. It's pretty complex. So I would like to just ask you to throw names at me or at each other of the coverage types that we have in our country. So by all means, what are they? So we have VA. Mm-hmm. What else?
We have individual commercial plans sold in different ways from insurance companies.
So the so-called individual market for insurance,
you buy it yourself.
Literally goes to an insurance company and buy healthcare coverage. Now, when we talk about VA, we also have TRICARE. And TRICARE is for those persons who made a career out of the military and then got that benefit called TRICARE, the individual market. What else?
We have Medicare.
Of course, Alfredo. We have Medicare. Livy, what else?
Well, we have Access, of course, but we also have the employer sponsor coverage.
Okay, so from employers, which also could, the government provided coverage is not necessarily similar, but it's still group insurance,
it's
if you will.
Health insurance.
Yeah. Group insurance from an employer, group insurance from a government entity.
Or unions.
Or unions, perfect. And then when we talk about Access, Livy, that belongs to a bigger picture, right? In Arizona, we know it as Access, but it belongs to a bigger umbrella, which is Medicaid.
Medicaid, yes.
Right. So, and then not only that, but in Arizona, we have the Access, and then Access, you have Kids Care?
Kids Care, yes.
Which belongs to CHIP.
Right. Yes.
Kids Care in Arizona, CHIP. And then what else? Long-term care is basically, to many, the only option in the form of Medicaid. Access also has acute care plans, and it also has long-term care, which is a unique, I would say, coverage that you have to qualify for, right? And then now you forgot your
I gave you the big category,
expertise.
but yes, the Affordable Care Act created healthcare.gov. So people that are shopping for individual insurance for their family during a specific open enrollment period, similar to Medicare, they can sign up and get coverage for themselves. But what makes it different from other commercial coverage is 9 out of 10 people in Arizona qualify for financial assistance in the healthcare.gov market.
Right.
So it's commercial insurance, you are buying it, but you get help from the federal government. 9 out of 10 people do.
And it's channeled through a government, what should
we call it? The marketplace.
The marketplace.
But it's easier to just call it healthcare.gov because that is where you go.
Right.
It doesn't exist anyplace other than out there in the cloud.
The government doesn't provide the insurance on the so-called Obamacare.
Not at all.
It's still insurance companies, but they channel through healthcare.gov, which is a government-run.
Yeah, it's like a government-run online store.
Right.
And then the individual companies sell their individual products on that store.
It's kind of a similar with Medicare. Medicare is a federal program, but who you enroll to an insurance company that Medicare is supervising.
Right.
But it's kind of the same thing.
Right.
You know, you enroll in a plan, you receive your Medicare card, and then you want an Advantage plan, and you enroll with an insurance company, and everything will do through that insurance company.
Now, we're expecting people to kind of know these things, right? In a sense, in a very broad sense, basic, because these are just forms of coverage available in the United States of America. And depending on your situation, you may interact with several entities. And not only that, but, if I'm working and I lose my job, I may qualify for Access. Then if I get a job and I don't make too much money, I may get some help in the marketplace. Then if I get a job and that employer provides the insurance, I could get it through. It is just avenues that allow folks to get covered. This should help the great majority of Americans to get insurance coverage, but I'm pretty sure there's still a percentage that falls through the crack. We have to go on our first break. We're going to continue to dive into a little deeper into this program. Stay with us. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. This is AARP Arizona Hispanic Connection. The subject today is the basics of Medicare, Medicaid, and ACA. So in the first segment, we just try to throw a lot of information at you just so that we can paint a picture of the avenues by which people can obtain health coverage. Most Americans should be able to find insurance through one of these ways. I'm sure there's still going to be some folks that are going to fall through the cracks. But let's start with Medicare. Alfredo, you work for the Area Agencies on Aging, by the way, an amazing organization that has, or agency that has great programs for the community. What is Medicare?
Medicare is a federal insurance for people over 65 years old or for people under 65 that are disabled.
And when you say that are disabled, that they have to be declared
Yes.
disabled by who?
By the Social Security Administration.
Perfect.
Social Security Administration approve the disability. Mm-hmm. Then the person start receiving disability payments after 24 months receiving disability payment. On the 25th payment, they will be enrolled in Medicare.
Right. Okay, before we go to the other programs, I want to ask Lenny, just briefly, and then we'll re-engage with you, Lenny. There's a lot of fraud in Medicare. Can you tell us a little bit about that and what your program does?
Okay, the Senior Medicare Patrol program is an outreach program to educate, empower the beneficiaries of Medicare to look for, detect, and report fraud, abuse, errors and omissions, or anything like that. Anyone that has a concern about the provider doing something wrong or they don't feel comfortable with it, they should call the Senior Medicare Patrol, because Medicare loses on average a yearly $60 to $90 billion in fraud.
Wow. That's a lot of money.
To that effect, the government, because the Medicare card in the past has your Social Security number attached to it, and that is one very easy way to commit fraud if somebody wants to do that. If they get your name and your date of birth as well as your Medicare, your Social Security number, bingo, they can commit fraud very easily, open bank accounts and do all kinds of things on your name. So to that effect, the new and excited new Medicare card have been given to beneficiaries since early this year, and they should be coming in no later than the January the 1st of 2019 without Medicare, without your Social Security number.
That is great news. Actually, yesterday I was in Yuma, and a lady showed me her card, and it has a totally different number and not the Social Security. We'll come back to you, Lenny, because I think it's important, and I know it's not easy, and it's just not natural for us to think in these terms and to basically take on a different attitude to basically help the government track fraud by simple steps that I will ask you in just a little bit. But I think it's very important. And now the actions that a person can take on Medicare, we all should take them also with our own insurance, because there is a lot of fraud going on. We'll come back in just a bit.
Thank you.
Livy, Medicaid or Access, can you share with us what is Medicaid Access?
Access Medicaid is a state and federal program that helps individuals and families with low income with their medical costs, with medical insurance.
Mm-hmm. It's not that simple, right? Access in Arizona, there are different ways or eligibility criteria for children, perhaps for pregnant women, emergency access. Can you just elaborate just a little bit more?
We call them categories.
Categories,
So
okay.
I think that's the easiest way to explain it to our clients. They're categories that they might fall depending on age and then their income level and household size.
Right. So whereas Medicare is not based on income, access is totally dependent on the income a person makes.
Correct. It's depending on the income.
Right.
And other factors as well, but mostly is in the income.
And so there is such a thing as emergency access?
Yes, there is emergency services for any members who, qualify for them.
When somebody's taken to the hospital in an emergency, they have no insurance. Does that apply in many instances? Or
Well, no, not necessarily everyone is eligible for emergency services. There's a small population that qualify for them.
Okay. And then you have Kids Care. How is Kids Care doing these days?
It's doing great. Kids Care is still available. It's something that we always want to emphasize to our clients, and it is for children under 19 years old that do not qualify under the other categories. And they can potentially be eligible for Kids Care and get the same coverage, but there's a premium attached to it,
Okay.
a small premium.
So the Kids Care, it's available with higher income levels,
Yes.
but there is, in most instances, a premium associated with, which is very reasonable, I think.
Yes, it could be the max for the premium for a household, and that's the whole family. So if there's 4 kids, it's $70. It depends also on their income, so it could go anywhere from $10 to $70 max.
So again, we're trying to paint a picture here. This is not an easy thing. We're trying to paint a picture of all the health coverage available to Americans, and this should cover most Americans, but we still need to learn to navigate. Some people like myself, I have to deal with my own insurance and then my parents with Medicare. So it's important to understand Medicare, it's not based on income, but access is. And we'll come back to you because there is some other elements to be understood about Medicaid. Let's come back to you, Alan, and you have been with ACA, Obamacare, Affordable Care Act, Patient Protection and Affordable Care Act since day one, just like I was, but I think you've gone deeper because you work for the Arizona Alliance of Community Health Centers. What is ACA or Obamacare, and how is it doing these days?
Without going into the politics of it,
Right.
It's a very simple program to understand. It is a program to provide health insurance to people that do not have employer coverage. They earn too much for Medicaid, and they're not old enough for Medicare because these were people that were kind of left behind. So if you were to purchase your own insurance in the old days, it was extremely expensive. So to make it more affordable, private insurance companies sign up with healthcare.gov. You go through an eligibility process based on income, and the less you earn, the more financial aid or assistance you receive.
Right.
Just to put it into perspective, the vast majority of people in Arizona that have a healthcare.gov insurance plan are paying about $83 a month, not the hundreds and hundreds of dollars.
Right.
Now, if you earn too much, yes, the policies are expensive.
So the more money you make, the less the less assistance you will get.
Right.
There will come a point if you make your 100,000s around family of 4 where you're not going to get a lot of help and you're going to get hit, obviously, with the full cost of the
Yes.
insurance.
And so this year, the current administration has tried to open things up a little bit more. So one of the things that's happening is that for the family or the individual that earns too much, and it is almost $100,000 for a family of 4,
Right.
if you earn too much to get the financial assistance, they're opening up short-term medical policies.
This is something not necessarily new, but with some modifications.
It's not new. It's been around. It's just that the current administration has said that you can have a short-term policy that lasts 364 days.
1 day shy of the year.
Right. And very quickly, it's a low-price product with low and limited benefits.
Let's stress that. You said that it's not necessarily a catastrophic type of insurance. So these plans are going to cost less money, They're not going to include the 10 essential health benefits.
Yeah, correct.
The pre-existing conditions are totally out of the picture. They will consider pre-existing conditions.
Yep.
And
you
what
have
else?
to, you have to qualify for it.
Okay.
So if you answer the questions that you've been diagnosed with something, you're not going to get in. So you have to be healthy. You're out. The other thing is it doesn't cover drugs. It doesn't cover pregnancy. And they can do something that other insurance companies can't do. You fill out the form, they let you in, but then you get sick. They can go back and check every one of your answers to see if by chance there's anything in your medical history where you should not have received it. So you could get stuck with the bill and get canceled.
Do you believe that these kinds of plans will require folks to really,
let the buyer beware.
Right.
It's real insurance.
Right.
Nothing wrong with it if it fits your need. But if you go out and buy a car, but they give you a bicycle, you may not be happy.
Of course.
And that kind of thing could happen.
Right. So again, we are trying to paint a picture of the insurance, the ways to obtain insurance coverage in America. We've mentioned several programs. We're emphasizing Medicare, Medicaid, and ACA. We still have about 2.5 minutes. Let's come back to you, Alfredo. So when we come to Medicare, who is eligible for Medicare? Again, you mentioned the age, but there's other requirements that has to do with having paid the FICA tax, right?
Well, Medicare is divided in 3 parts. So when you enroll first in Medicare, you enroll in Part A and Part B. It means that your enrollment is not complete. So you need to coverage for drugs. Right. The Part A is free of cost. I mean, it doesn't cost you anything. If you
premium what?
Premium free.
Right.
If you worked at least 10 years, and they don't have to be consecutive. Right. They have to be 40 credits in your working lifetime. If you meet that requirement, your Part A is free of cost.
Okay, so when we say that you qualify for Medicare based on having worked 10 years, you're literally just talking about Part A, which covers hospital, right?
Yes, because it covers hospital.
And then what happens to Part B?
Then you have to get Part B, and Part B has a cost.
So you have to literally buy.
Yes, you have to buy your Part B. It's like
coverage.
It's like you buying insurance. Okay, when you buy insurance, you pay your premium. That's what it is. Part B. Part B, you pay a premium for the right to have that insurance.
And you said that it's not complete. When you go to the Social Security Administration, you sign up for Medicare, they give you your Medicare card. It only has Part A and B. So then you need
to complete that with a Part D for your drugs.
Okay.
If you don't have the Part D for your drugs, then when you need it, you're not going to be able to get it because you have to get it in a specific period of time. And also, you're going to get a penalty if you don't get it in the beginning.
So
it's better
need to be very aware that they need to act quickly.
When they leave Social Security after they enrolled in A and B, they're going to receive the card. They should know that the drug part is missing, and they need to find a drug plan or an Advantage plan or something that includes the drug plan.
I'm going to come back to you because we need to complete this thought of the parts and then the options of Medicare. Okay. But we have to go on a short break. Stay with us. This is AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The topic today is Basics of Medicare, Medicaid, and ACA. So let us just complete the thought, Alfredo, because I think this is very, very important. So number one, when people get their Medicare card and Social Security, that is not complete. They have to complete their enrollment. You mentioned that an option could be for them to get a Part D plan, and they're all set. Because now they have the 3 parts that you mentioned.
At least they have the 3 parts and the enrollment is completed.
But now that would be called, as I understand it, original Medicare, correct?
Well, original Medicare is the blue, white, and red card that you get from Social Security, the part that has A and B. That's original Medicare.
Right.
Then you have a Part D, what we call it a stand-alone
Right.
Part D plan.
But
So
there's
it's
another
separated.
option, I understand.
There are two more options.
Okay.
Okay. To that combination A, B, and D, you can add a Medigap policy
Okay.
to cover the 20% from the original Medicare.
Because
It doesn't
original
cover
Medicare
medication.
doesn't cover 100%?
No, it covers 80-20. 80, the government pays 80%, and the person pays the 20%.
Got it.
So if you want to offset that 20% and get it covered, you buy a Medigap policy.
Got it.
And the policy will pay for that
So
20%.
you would have Part A, as hospital, Part B, doctors, Part D, the prescription drugs, and then you buy supplemental insurance
Yes.
to offset the cost of the 20% that Medicare doesn't cover.
Yes.
That would be original Medicare, so to speak.
Exactly. And you have a specific time of 6 months to get your Medigap.
Right. Yeah. Now, how about the second option? Let's say somebody wants to go a second route.
Okay, if this first option is too expensive for you, there is a third option that is called Advantage Plan.
Okay.
And the Advantage Plan include the 3 parts of Medicare.
Okay.
So you're enrolled in A, B, and D
Right.
with the same plan, and usually it's cheaper because you don't pay 20%, except in some occasions, but mostly you pay co-payments.
So just to clarify, under the Advantage, it's going to be a little less. What are you giving up for paying less in Advantage? Is
Well-
it the nationwide providers versus the more countywide? Is
Yeah.
that the main thing?
When you have original Medicare, either you have it with the Part D or the Medigap, it doesn't matter. You can use it in any of the 50 states, and you don't have a network
Got it.
of providers. You have all the providers that works in
That's why
Medicare
many
in
people
any
prefer
state.
that, especially if they live in 2 states.
If
correct?
they live in 2 states or after they retire, they plan to visit family and spend long periods
Got
long periods with the family in another state.
But if somebody's okay with having more of a local network, then Advantage would work
Then
with them.
exactly, because the Advantage Plan works only in your county,
Right.
And,
And it's
it
gonna
doesn't cover you outside your county except for emergency.
Right. And it's going to be cheaper at the premium level.
Most of the plans has no
Additional-
premium,
right.
additional
So
premium.
It'll be more like something like 300 versus 130, around that, roughly. The difference in cost will be about 300 with one versus about
Well, yes,
130.
because
roughly, it doesn't
yeah.
have to be exact.
You have to include the Medigap price and the Part D price that are not included
Exactly.
in the
We'll come
in the
back to you.
Advantage.
That's
But yeah,
very good. Livy, come back to you. So, access. How do people qualify for access? What's the process to apply?
So the process is basically there's an application that they need to submit, and then they need to provide proof of their sources of incomes, and then they go based on the household size. And again, Access has different categories that they get screened for to see where they fall and if they are even eligible based on, again, income.
So you get a person now. Can you help me with this terminology? There's something about mixed families. Is that the term? Is that the term that they use when you have people that are U.S. citizens? Maybe one of the parents is not. How does that called? Mixed families?
Mixed immigration family.
Okay.
Yes.
How do you handle that? Can somebody qualify for access and not the other? I mean,
Yes,
and
definitely.
then they have to count the income of the person who perhaps is undocumented. Is that how it goes?
Well, yes. So the way that I can explain it easier is like if we have a family of 5 and 2 of them do not have an immigration status, and the rest they're applying for the kids only, is the parents' income that is used towards their determination to make see if they're eligible, but they count them in the home. So it's still a family of 5. It's not a family of 3.
Got it. So basically, they still count the household number and the incomes that everybody's bringing in to
Correct.
determine eligibility.
Yes.
And I assume that you first see if they qualify for full access. Then some might qualify just for the kids' care if they make a little bit too much, and so on and so forth.
And we see that a lot.
A lot,
And this is
okay.
why I work really closely also with Alfredo. I work really closely with the organizations for the Affordable Care Act because some of our families end up with marketplace applications. Some of them go to, now ready for Medicare, and some stay in access in the different categories.
You do not handle Medicare, I understand.
No,
correct?
we do not.
So when it comes to Medicare, then you have to go to the area agencies and agent.
Correct.
Okay, perfect.
We do help with the Medicare saving programs, which acts as possibly a supplement for.
I am not that convinced that everybody's going to be so clear after this show, but I think, but I think it's good. I think it's good so that people understand that the avenues of getting health insurance and how they interact with each other. So let's come back to you, Alan. Okay, how does the marketplace work? Who goes to the marketplace?
We're joined at the hip with access and marketplace.
Right.
Most people don't know what they qualify for.
Okay.
So a family is uninsured. They come to an organization that has assisters like Livy, and I'll give you the phone number and everything in just a moment. And we take you through some basic questions to establish family size and income. And if we can quickly decide, okay, David, you fall in Medicaid, and Livy, you fall in the marketplace, we know which application to start. It's all online. There are great systems that sort it all out. We just have to collect the information and make sure we get the correct information. You might be surprised. We've been through applications where somebody said, "Oh, what about my other 5 children?" Right. Wait a minute, we've got to start all over. Right. So you give us accurate information, we put it in, and we then leave it to the individual to decide in the marketplace which plan they want. In Maricopa County, for 2019, there will be 4 different companies competing, offering plans, and each one of them will have between 4 and 6 plans. So there will be real competition,
right? And
so you can decide on what level of coverage you want.
And that was going to be my next question. The matter of levels are still. I mean, they still go by that. Your platinum, gold, silver, and bronze.
Right.
Okay.
Very little has changed with the actual marketplace in spite of all the noise. We're still here to help people. People can still get financial assistance, and open enrollment is November 1st to December 15th.
Say that again?
November 1 to December 15.
Got it. Now, the prices, are premiums going up or not in terms of in the market?
In Maricopa County.
Maricopa County.
Excuse me, in Arizona.
Okay.
Prices are going down a little bit from those 2 companies that were in the market. We don't know about the other 2 that are coming in, but what we can say is they're not going up.
Right. Let's come back to Lenny. Lenny, you work in the fraud, area, and do you see that some of the things that apply to Medicare may apply to other types of coverage where we can actually be proactive and help, crack down fraud?
Definitely so. If a provider, if you are a beneficiary, more than likely you will receive an explanation of benefits either on a monthly basis or on a quarterly basis, and or you may get something from Medicare called a Medicare summary notice that comes usually on a quarterly basis. You should should be like a bank statement that you get. You should look at this thing and balance the like a checkbook.
Right.
You need to look at this thing and balance it and see if indeed you receive all of those things that are on that explanation of benefits from your providers.
Right.
And if there is a difference, you should also notice that and call somebody. Call your provider back or call Medicare or call Senior Medicare Patrol. We will take care of you. We will assist you with that issue. But we want to make sure that the providers do not purposely commit fraud and abuse.
So is that where the fraud comes from? From providers mainly? What do they do to commit fraud?
Most of the providers are legitimate and they are good. There are some that are kind of like the crooked ones, anyone. They could be hospitals. They could be medical family groups, X-rays people, laboratories, pharmacists. All of these people could in essence, commit fraud by claiming to Medicare or the insurance company that they have given you more than what you actually have received.
Right. Just, I think we have a couple more minutes. Anybody, how critical is it to understand networks? How critical is it to understand networks? Because I believe it is.
Yeah, networks really come into play with Medicare, and I'll let somebody else address that. But also, when you purchase a plan on healthcare.gov, the company you choose will have, well, first of all, they're all HMO plans, and HMO plans have a specified group of doctors and a specified group of hospitals. Mm-hmm. One of the things that we're very happy about is now with 4 companies selling in the marketplace in Maricopa County and 3 companies in Pima County, more hospitals will be available. Because last year when you had just one company, it was take it or leave it.
Right.
Now you can say, oh, I want my kids to go to Phoenix Children's Hospital. They are a part of one of the groups, but not the others. So networks are important because you pay much more if you go outside of network.
Right, and it's very important because, I mean, we were talking off the air that there's sometimes people will call you to offer the so-called preventive services, and it's a totally foreign company to the network, and then you end up paying the bill. Alfredo, would you relate this in basically 30 seconds?
Well, I'm going to talk to you more about the network in Medicare,
Right.
Because it's very important, especially if you're talking about Medicare Advantage. Medicare Advantage, all the plans belong to an insurance company.
Right.
And every insurance company has a network.
Okay.
Plans have networks that could be smaller or larger. There are PPO plans, there are PFFS, there are point of service, I mean, lots of plans. They all have networks. The important thing is, and I talk with my client, is when you enroll in this plan, your doctor has to be in the network, but all your referrals to a specialist has to be in the same network. Otherwise, you would pay the entire bill.
Wow.
So what you do is sometimes the doctor don't refer you, they refer you to a doctor that they know, but the doctor doesn't take the plan.
Wow.
You have to ask before to go, do you take the plan? No, don't go to the appointment, cancel, talk to your doctor and get a new appointment.
In conclusion, folks need to access their care in the network of
Yes.
the plan they purchased, because if not, they're going to end up paying 100% of the bill.
To have your Medicaid less expensive, yes, you need to have it in your network.
Very brief. We have
And
to
that's the
commercial break.
same as with your employer-sponsored
that's
insurance.
correct.
Network. So it applies to most except traditional Medicare and Medicaid.
We're going to have to elaborate a little bit more on that. Stay with us. This is going to be our last break. This is AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. This is I love this subject, by the way. Love it. And I think it's a lot of moving parts. But once decide to understand it, I think they will. I think the hardest part is not to give up, because a lot of times you start with, too complicated, and then you stop trying. So just bear with us. Let's learn together. Libby, coming back to access. So we're talking about networks, and we're talking off the air that there is some elements of network also with access. Is there?
Yes,
or are there?
There is. The client will select the plan that they want to be enrolled in, and based on that plan, the providers must be in network with them. So
Okay.
if their physician does not take the plan, they will be charged a full price.
Can you tell us briefly about what's going on with Access Complete Care? What is that? I think it launched October 1.
Yes, it did. And the easiest way that I'm able to explain it is an integration of plans.
Okay.
So in the past, the REBA or behavioral health, and then the insurance plan was separate, and now it's all together. It's one plan, so it's easier.
Okay. behavioral health basically is what's been integrated, can we say?
Yes.
So behavioral health used to belong to a separate entity. People needed to navigate away from their plan to kind of access it.
Yes.
Now the company that a person selects is, let me just use the word, required to include behavioral health so that the what is called consumer doesn't have to go out and navigate away.
Navigate
from,
two different plans.
That's not too complicated.
No.
Yeah.
Yes, it's a
Yeah.
good improvement.
Let's see. I believe there's another element here, Alfredo. There is an element of an addition to enrollment periods for Medicaid Advantage, which tells me personally that there is some kind of encouragement to folks to enroll on Medicare Advantage versus staying on original Medicare. But what is it exactly?
Well, indeed, what is happening and the new change is that you have the open enrollment between October 15th and December 7th, and you enroll in a plan. But starting January 1st until March 31st, you have the chance to change that plan that you enrolled first for another plan. So you can change from an Advantage plan to another Advantage plan. You can change from original Medicare and Part D to an Advantage plan. You can modify from an Advantage plan to original Medicare Part D, but you cannot change Part D to another Part D during that period.
Okay.
It's only for Advantage plan.
So this 3-month period, right?
Yes.
Can somebody that is in Advantage move to original?
Yes.
Okay.
They can move
So
to
that's pretty
original.
fair. I thought it was just
They
one
give you
month.
another opportunity
Got
to
it.
do it instead of one period a year, which is the open enrollment. You may have
So
another.
is the spirit
period.
here that perhaps people try an Advantage plan that they might not like, and then they want to give those folks the opportunity to move back to a different one or original or vice versa?
Yes, it's a possibility to help the person if something happened in between the moment that they enroll in a plan and when the plan begins. Let's say that, for example, you didn't know and you enroll in a plan and then your provider left the plan.
Got it.
And you want to follow up your provider. Normally, when you are in a plan, you stay with that plan until you can change. You cannot follow up your provider with another plan. Now you may be able to do it.
Perfect. Let's conclude. And what I would like to do is see how the programs interact. Let's try this, okay? So whenever the scenario that I paint relates to your program, you jump in. So here we go. I am unemployed and I have no health insurance. Who can come to my rescue?
I can
With
access.
Access. So I lost my job. I lost my coverage. So now I go to Access. I don't need to have income at all. No job. They will take me and qualify me. Pretty
based
much.
on income. Yeah, because you have no income.
Got it. So I pick up a job, and my job offers health insurance. What can I do?
Because you can still come to an organization like you, and you can still be potentially eligible for access and your employer-based coverage.
Both?
Yes, both.
How does that work?
Well, it depends on income. Again, we're
Okay.
still gonna. It's all based on income. So if your income is under the federal poverty level, you might still be eligible to continue with access and have your employee-based coverage.
And who's going to pay first?
It's going to be the employer-based coverage first,
Got it.
and access act as the secondary.
So it will be more like helping you with whatever your plan doesn't cover.
Correct.
Now, what if I just decide not to get my employer offered coverage because I qualify for access? Can I just decline that and go to access?
If as long as you're eligible for access, you
Right.
can continue with access if
Got
you
it.
decline.
So
it.
access will not say, oh, I cannot qualify you because you had insurance with your work and you declined it. They will not tell me that as long as I qualify with income.
Now, there's different things, though. One important thing, and access is very complex, but you have to know if you're an individual, you're an adult, and you just started your job, and you're with access, you can continue with access as long as you are eligible based on income.
Got it. But I don't, in other words, access, I don't have to, access will not penalize me if I am eligible based on income for declining to take my employer coverage.
Correct. They
Thank
will
you.
not.
So, okay, So then I am employed. I decided, you know what? I make more money. I move out of the realm of Access. Now I'm full, making decent money. I can buy my own insurance at work. Typically, the employers will pay a bigger chunk of the bill. Let's say 75%, just to say an example. You pay your 25%. I'm having a, good time. But then I moved jobs. The new company does not offer insurance, right? And I made enough money to be disqualified for Access. So then what happens?
That's a perfect place where the Affordable Care Act and the healthcare.gov plan comes in. And because you lost coverage, you can sign up any month, any time of the year.
Okay.
Yes, there's open enrollment, but in the case you laid out, you lost your coverage. So you could get a special enrollment period, and depending on your income, you may or may not qualify for financial assistance.
Okay, so I decide that I don't believe in insurance and buying insurance, or I just don't think, I think I don't have the money. So I decide to say, you know what, I'm just going to take care of myself and hope for the best that nothing happens. What's going to happen to me in 2019 if I don't have insurance?
There is no longer a IRS tax penalty in 2019. So if you have no insurance when you do your taxes for 2019, you will not be penalized. However, you are 100% at risk. What happens if you have an accident and end up in the hospital?
Right. Got it. I'm in a marketplace plan. I have a marketplace plan, or I'm an employer. I'm covered by my employer, and I turn 65, Alfredo, and I plan to continue to work after 65. What's the scenario there?
If you're going to continue to work and you are insured by your employer, you don't have to enroll in Medicare at all.
Okay.
You can't get Part A because Part A is free of cost and it's an additional insurance to what you have, but you can postpone your Part B until you lose that coverage, either by retirement or because you were laid off or for any other reason. Once you lose it, then you go immediately to Medicare.
Are there scenarios where the insurance companies from the employer requires the individual to sign up for Medicare when eligible?
Yes, there are some insurance that make that requirement, and you see that more often in unions. Group health
so
insurance.
how are the workers supposed to know that? Are they going to?
Oh no, the insurance let
will
you know.
let them know.
Yes.
You know what? You're turning 65.
You're turning 65.
I will not cover you anymore. You have to go to Medicare.
No. What happens is sometimes is that the insurance can work with Medicare.
Got it.
So, but you have to enroll in
I
Medicare.
see.
So the person enrolls in A and B doesn't have to get the Part D because it has coverage.
Mm-hmm.
The coverage covers the 20% of A and B and covers the medication, the group health insurance that they have to the union. But yeah, if they require mandated by their own insurance to enroll in Medicare, they have to
Real
do it.
quick, Medicare enrollment periods, real quick.
Now, starting October 15th until December 7th, every person who has Medicare, remember this is the period where you can change your plans on your enrollment. Either you have an Advantage plan or you have a Part D plan for your medication. This is a period to do it.
The best way to reach you?
You can call directly the 1-800-432-4040, which is at the DES office, or you can call the 602-280-1059, and any counselor will help you with your Medicare.
If they use the internet, it's just good to go to area agencies on agent Region 1.
Yes, and you can submit even your information through online.
Open enrollment for ACA.
November 1 to December 15, December 12.
November 1 through December 15,
15.
so a month and a half pretty much.
And help is available all over the state. You call 800-377-3536, 800-377-3536, or go to coveraz.org.
That's a good one.
And
any related to enrollment periods, there's no such, not to worry about it in terms of access, that doesn't really apply, correct?
No. With Access, there's no enrollment period. They can enroll any day as long as they're
Perfect.
eligible.
I want you to have the last word, Lenny. Fraud prevention. Just give us in 30 seconds your conclusion.
If you're a Medicare beneficiary, be your own advocate. Always ask questions. Am I going to be covered? Where are you sending me? Is this hospital covered under the network that I'm in? Is the anesthesiologist going to be part of the network or not? I don't want to be hooked up with having to pay for things that I don't have to.
Thank you so very much. We've tried to paint a picture of the healthcare that is available in our country. I believe we did a pretty good job. I hope you agree with us. We gave you some ways to reach these agencies. You can also just reach us through our page, and I'll be glad to respond to any messages. At AARP Arizona Hispanic Connection, this is a Facebook page. Thank you so very much for joining us. This was AARP Arizona Hispanic Connection. Have a great day.